I was the youngest in my family, and my grandfather basically knew that I was going to be his disciple, so he took me under his wings. And when people ask you, well, at what age do you start learning the medicine? I couldn't really say at what age because it was always there. And so you just became part of it.
I would love to have met his grandfather because I know that, his grandfather was one of the strongest influence on his life. And his grandfather started training him when he was just a little boy.
I was his last disciple. So when I was learning from him, he was already in his 90s. I would accompany him to Chinatown. He would treat people, and I would observe that. And there was always a great interest. And he would basically always have dialogues with me, asking me questions, really, and say, well, why you think this person had this type of complexion? So you would be able to try to construct a story about why you believe the person was ill, rather than informing you, well, this is what this means. So it's not really a knowledge-based type of training. It was really more of a question and answer base. At the age of 15 to 16, that was when I essentially officially became ordained into the Taoist tradition. I didn't really believe it was my role to teach this. In a way, the students found me instead of me finding my students.
The ability to sit with another is what I admire in Jeffrey, and his ability to offer compassion to everyone he meets. That's one of the reasons that I continue to follow and study with Jeffrey Yuen.
There are lots of aha moments in studying with Jeffrey, and there's a sense that it's endless, that it's infinite, and it's tremendously complicated. So not only do you have this awe-inspiring medicine to follow around, but you have a sense that actually in this lifetime you're not going to get to the end of it.
It is my mission now to really teach Chinese medicine and teach it in a way that it makes it classical Chinese medicine, makes it from the lineage, from the tradition that I was trained in, which is very different from what is being taught in most of the schools of Chinese medicine today. Traditional Chinese medicine, when it came into the United States, came because of the operations that they were witnessing in the Chinese hospitals, where they were using acupuncture for anesthesia. And consequently, it attracted the interest of not only anesthesiologists, but anyone who was interested in managing pain. And as a result, it got imported into the United States, primarily dealing with pain management. And so it's a misnomer to assume that traditional Chinese medicine deals mostly with pain. Obviously, traditional Chinese medicine, as a system of medicine, deals with all types of conditions and all types of diseases. The only drawback is that it tends to draw heavily upon Western medicine, which is good if you're interested in integrative medicine. But it does not allow, however, the understanding of Chinese medicine within the framework of the Chinese medical thinkers. Is being analyzed more within the framework of Western medical thinkers, and that becomes a clash of philosophy per se, because Western medicine tends to be more mechanistic. It's more like trying to define the system, which system fails, and then consequently we deal with, like a mechanic, deal with the different segments of the body. Whereas Chinese medicine, or as a whole, is a holistic medicine. It's really saying how one system affects another system, and you couldn't really go to see a specialist without seeing someone who really fully understands the whole body. Well, classical acupuncture means that you begin first with the classics, and the classics in Chinese medicine would be the Huangdi Neijing, which means the Yellow Emperor's Internal Treatise. It's a textbook that essentially itemizes a lot of different pathways that we think of that we can use to, in some ways, guide the individual in terms of his or her healing. And these pathways are then grouped together as channel systems. So when you practice classical acupuncture, you're really having access to these various channel systems which modern or traditional Chinese medicine really do not focus all of their attention on. For example, modern Chinese medicine or modern Chinese acupuncture in particular would be known as TCM. And in TCM, they only use primarily the primary channels, which is very limited from a classical point of view because you have all these other channels that exist that should be in many ways an option that's provided for the client and in many ways providing them with greater opportunities for healing. So it's not so much does one system seem to be more effective compared to another. It's really that you're learning a system that provides you with greater insights, in my opinion, to the vastness of the human body through its mental process, through its physical process, and also through its spiritual process.
TCM has access to 12 meridians, and classical acupuncture has access to about 70. So all of the meridians of acupuncture are available in classical acupuncture. In other words, TCM has the big giant expressways of energy, pathways, and classical acupuncture has the big expressways, and you can do a lot with those, but it also has like the boulevards and the avenues and the roads and the streets all the way down to the tiny alleyways. And so it's a really massive network.
With traditional Chinese medicine, I was taught that I could be supportive of a person, but that I didn't have the tools to basically be able to help a person to heal from cancer. There are tools out there, and there are many different ways that people find healing. And for myself, classical Chinese medicine has given me more of those tools. I can access meridian systems now that I know that can help to keep a person who has cancer that may not be able to heal from it, but to help keep it at a latent state to where it's in a state of remission, even though it's still there lurking. And how do you help keep it latent so they can have a good lifestyle? Those are the things that I have learned from classical Chinese medicine. Not that you couldn't have something like that from TCM, but from my perspective, I learned other meridian systems that I feel might be better used with a diagnosis that's life-threatening.
I was diagnosed in January of '09 with Burkitt's lymphoma, stage 4. And it's March 2011, and I've outlived 3 death prognoses, and life is good. And I really attribute a huge amount of that good health to acupuncture and Sissy specifically. There was an aspect of Sissy's care which spoke very deeply to me, and that had nothing to do with radiation or acupuncture or anything. It had to do with her looking at me as I was lying there on the exam table here. And she said, I had been given a very dire prognosis at the time, 2 weeks to 2 months. And she said, I'm going to try to make you better. But if I can't, just know I'll be with you on this journey all the way as far as you need me. No doctor had said that to me.
Andrew's an amazing man because he's made a decision to live his life. And anytime we are seeking healing, if we get to the place to where all of our focus is just there, then in some ways we're always focusing on what's not right with us. And I love the fact that Andrew's going to Venice next week. He's been to France. He's been, he travels everywhere. And he's vibrant and embracing life. And as long as we can all embrace life fully, I definitely believe that's one of the reasons Andrew's here.
I had those 20 radiation treatments with no side effects whatsoever. And that seemed to be relatively remarkable, judging by my fellow patients in the waiting room and by the response that my doctors had, specifically my the radiation doctor. And I was getting acupuncture every day to deal with that. And I think that specifically has been very important. I recently had a completely normal bone marrow test. It regenerated on its own. So I think that Sissy and her care have much to do with that. I think it's very powerful.
So, Miss Charlotte, how are you doing? Look at my nose.
Good.
Okay, when I saw you a few days ago, your throat was hurting and your tonsils were swollen. Do you still have a sore throat? Can I see today? Open wide and say, ah.
What I like about Sissy, I guess, is, or their concept is, they look for the cause of the issue as opposed to just treating the symptom of the issue.
This point will run all the way up your arm and it will land right here. So we're going to do that magic point there and see if we can get it to go. Yep, that one.
On my nose.
On your nose? Like you want me to do it on your nose?
No.
Oh, darn. How about beside your nose?
No.
Not beside your nose? Why not? What about the eyeball points today?
No.
No. Are you sure?
Yes.
Okay.
Phil was in a car accident when he was 16 and he had really severe injuries to his knees, and he was told that he would never be able to walk up and down stairs comfortably again.
I had very little hope, being that I was told that cartilage was non-replaceable. It's something that once it's been destroyed and it's been dissolved, that it cannot be replaced. So for me, I was looking towards acupuncture more of as a pain relief, not necessarily as a way to help my body heal itself.
Qi means air or atmosphere in Chinese medicine. It's the movement of energy in the body. So when he came and we took the pulses, it was really clear that what was going on was that the defensive qi on the outside of his knees had gone into the joint at the time of the accident and become stuck there. So his knees were not able to move freely because the defensive qi, which we call the wei qi, was trying to rescue the knee and had become immobile. His treatment involved a meridian we call stomach divergent meridian and spleen divergent meridian also, and the needles were placed in such a way that it called on that defensive qi that was stuck in the joint and instructed it to come back up to the surface. And now I think he has full mobility.
My first appointment seeing Anne was, I can't describe it anything other than a life-changing experience. I was able to leave that office able to walk up and down a flight of stairs at dramatic speed, rather than being the 75-year-old man who slows everyone down coming up a set of subway stairs in New York City. So for me, it was an instant and dramatic change. The greatest aspect about it, when I talk about it being life-changing, is it is about healing. It's not about triage. It's not about stopping the bleeding or giving up on a possibility. And so just even the aspect of hope is something that is, I think, very important and very present. There's a sense of absolute euphoria being the fact that you're no longer in pain, and it feels like you're walking on a cloud when your knees feel like lead. To no longer have that feeling anymore is extremely wonderful. But then there's this other side of you that is in some ways almost angry or upset by the fact that it took you 14 years to get this. That I think for me the biggest problem was knowing that the people that I had been working with were all well-intentioned, but didn't have the ability to actually help me.